You can swallow one painkiller for a headache, a sprained ankle, or a painful tooth. The tablet has no information about which part of your body hurts. After you swallow it, the tablet breaks apart and releases its drug molecules. Most of those molecules are absorbed through the small intestine and enter the bloodstream. Your circulation carries them through the body, including places that feel completely normal. The painful area receives the medicine because blood reaches that tissue too. To understand why relief appears there, we first need to understand how injured tissue produces pain. Imagine that you twist your ankle and damage some of its cells. Damaged cells and nearby immune cells release chemical signals around the injury. These signals increase blood flow, attract immune cells, and begin the inflammatory response. A group of signaling molecules called prostaglandins becomes especially important during this process. Prostaglandins make nearby pain-sensing nerve endings more sensitive. These nerve endings are called nociceptors, and they respond to potentially harmful conditions. Once sensitized, a nociceptor can react strongly to pressure or movement that normally causes little discomfort. The nociceptor converts that stimulation into electrical impulses traveling along a sensory nerve. Those impulses enter the spinal cord, where the signal is processed and passed upward. Several regions of the brain then produce the conscious and emotional experience that we call pain. Since this pathway has several stages, different painkillers can interfere with it in different places. We can begin with ibuprofen, one of the most widely used painkillers. Ibuprofen belongs to a family of medicines called nonsteroidal anti-inflammatory drugs, or NSAIDs. After entering the blood, ibuprofen molecules move into many tissues throughout the body. Inside those tissues are enzymes called cyclooxygenases, usually shortened to COX enzymes. COX enzymes help convert a fatty molecule from cell membranes into prostaglandins and related signals. During inflammation, cells around the injury increase the machinery that produces these prostaglandins. Ibuprofen enters the working pocket of COX enzymes and temporarily blocks their activity. With fewer active COX enzymes, the injured tissue produces fewer prostaglandins. The nociceptors around the injury gradually become less sensitive. Pressure and movement now trigger fewer pain impulses traveling toward the spinal cord. The inflammatory swelling and warmth can also decrease as prostaglandin signaling falls. The brain receives a quieter stream of incoming signals, so the pain usually feels weaker. Relief is strongest where prostaglandins were helping to amplify the pain signal. Ibuprofen molecules are also blocking COX enzymes in other parts of the body. That matters because prostaglandins perform useful jobs in healthy tissues. They help protect the stomach lining and support blood flow through the kidneys. Some related molecules produced through the same pathway also help platelets form blood clots. Blocking these processes can contribute to stomach bleeding, kidney problems, and other side effects. This is why the dose, the duration of use, and a person's medical condition all matter. NSAIDs tend to work best when inflammation and prostaglandin sensitization are important parts of the pain. Pain caused by an injured or malfunctioning nerve can depend on different mechanisms. In those cases, ibuprofen may provide much less relief. The word painkiller covers several drug families that act in very different ways. Acetaminophen, also called paracetamol, appears to act mainly within the brain and spinal cord. Scientists still do not fully understand its mechanism, although several central chemical pathways probably contribute. It can reduce pain and fever while producing very little anti-inflammatory effect in peripheral tissue. A local anesthetic at the dentist works through a much more direct local mechanism. The anesthetic is injected close to the sensory nerves carrying signals from the tooth. Electrical impulses normally move along these nerves. When sodium channels open in sequence, local anesthetic molecules enter the channels and prevent sodium ions from passing through. Without that sodium movement, the electrical signal cannot continue along the nerve toward the brain. The numbing stays local because the dentist places a concentrated dose beside the specific nerves. Opioid painkillers act mainly on opioid receptors in the brain, spinal cord, and other tissues. Activating these receptors reduces the transmission of pain signals and changes how the brain responds to them. Opioid receptors also control other functions, which helps explain effects such as constipation, sedation, and slowed breathing. Topical painkillers use location in a simpler way because they are applied directly over the painful area. Some of the medicine enters nearby tissue, while a smaller amount may still reach the bloodstream. The most useful drug therefore depends on the biological process producing the pain. Reducing pain also does not necessarily mean that the damaged tissue has finished healing. The medicine can lower inflammation or quiet nerve signaling while repair continues separately. Painkillers should be taken according to their directions because the same mechanisms that provide relief can also cause harm. A swallowed painkiller reaches many parts of your body and you feel its benefit where it successfully weakens the active pain pathway.